So, Dr. Anju, there are two types of tests that we are going to recommend. And one is to diagnose the condition. And second is to diagnose the outcome of the condition.
Hello, friends, and greetings from VLCC, and a very good evening to you all. I'm Dr. Anju Ghei, Vice President and Head Preventive Healthcare at VLCC, your host for the session today. And we will understand today what PATH tests are, what they tell us, and how we can benefit from them. Our expert panel includes Dr. Angeli Misra, Director, Lifeline Laboratory, eminent cardiologist, Dr. Dhiraj Bhatia, and nutrition expert, Dr. Deepti Verma, each of whom you will meet shortly. And guess what? This is the 12th webinar in our monthly series, our educational contribution to holistic wellness through quality information and healthy lifestyle choices. With this, we complete a full year of engaging you all in conversations with eminent doctors and specialists across disciplines to develop deeper understanding of your health and how to enjoy every moment of our life to the full. Of course, we must know how to take care of our bodies and remain healthy, right? Yes, so let's get going. In the healthcare, so the guiding principle of first diagnose, only then prescribe is drilled into every medical student. And that's why, medical students, they spend so much of their training deeply understanding the body, how it works, learning how to treat, and then to, how to treat, first to diagnose using their skills, like signs and symptoms, biochemical or PATH testing, multiple forms of imaging, and so many other modern scientific aids. So today we are going to focus on PATH tests, right? And so let me first invite our expert panel to address the questions you all have shared with us while registering for this webinar. And so let me start with our first panelist for today, Dr. Dhiraj Bhatia. Delighted to welcome and introduce to you Dr. Dhiraj Bhatia. And, Dr. Dhiraj Bhatia has over 35 years of clinical consultancy practice in New Delhi and has been a senior consultant cardiologist with Fortis Escorts Heart Institute and Research Center, and of course, Max Super Specialty Delhi. And he has been honored twice by DMA and IMA as the Doctor of Excellence awardee. He's also been part of core medical research team, which has laid down guidelines for defining the management of obesity and PCOS in Asians. And of course, he's been the senior medical advisor to VLCC for the last 20 years. So good evening, Dr. Bhatia, and welcome to the webinar. And thank you so much for joining us today.
Dr. Anju, thank you for the introduction. Very nice to be back again with our viewers, and let's hope we can add some knowledge to the table. It's, like you said, it's our 1 year running now, 12.
Right.
So it's really been an honor to be here with you. And it's really nice that we have Dr. Angeli Misra with us. Lifeline is a leading laboratory, which, you will further introduce her and the lab, which has been doing very good work over, I think, more than 30 years. And, we've had a very close association. So I think let's start the ball rolling.
Yes,
so
absolutely.
I think
absolutely.
you got the bank of questions with you. So,
Absolutely. So let's get started, of course. So the very first question, Dr. Bhatia, is that many people who come to VLCC, they complain of not being able to lose weight in spite of trying so hard. It's a very common thing we hear. So Dr. Bhatia, what is the commonest cause of obesity, and what, according to you, what test would you recommend for the same?
Right. So before we go to the test, we should know the commonest, like you're saying, cause. I would say there are about 30 causes which lead to overweight and obesity. But from our point of view, there are just 7, 8 which we see regularly and which are very important. Out of those, narrowing it down, the most important, I would say 80% is because of when you start gaining weight, when your BMI goes up, and you get your central obesity high, the most important thing which it leads to is insulin resistance. And insulin resistance then leads to high insulin, which we call hyperinsulinemia. High, hyper means high insulin, and anemia means blood. So high insulin in the blood. And that then leads to something called metabolic syndrome or syndrome X. So there's a criteria for that. So this should not be missed. So clinically, they'll give you a history that we're trying our best and we're not losing weight. They'll say that, or they'll say that we're gaining weight very, very easily. That's the second part. Thirdly, very important to get a family history of diabetes. There'll be a family history of diabetes in this gamut, where you have insulin resistance, or let's give a broader name to it called pre-diabetes. This is before diabetes comes. And this stage is very important to catch because this is totally reversible. So diabetes is difficult. Early stages might be, but later on, as it steps up, it gets tougher and tougher. So the history is very important, like gain weight easily, can't lose weight easily, family history. Then very often there's a huge association of PCOS, which you also see, polycystic ovarian syndrome. And the reason you gain weight in PCOS is because of high insulin. Then you have another condition like obstructive sleep apnea. Again, in OSA, you gain weight because of the insulin going high. Because at night, your oxygen dips because of snoring and apnea, and the body releases stress hormones. There are three of them. Heading the list is insulin, then cortisol, and catecholamines. And all are weight gaining, which actually cause high insulin finally. Then you have, you get a history of gestational diabetes. So a lady says, I had a problem, but I'm absolutely okay now. But she's gained weight and she's not checked her sugar levels or insulin levels or HOMA levels, which Dr. Anjali talked about. And that's how, we pick it up. And high birth weight babies. Also, central obesity is very, very important. Now, central obesity in males more than 90 centimeters in Asian Indians. Abroad, it's 102, but here it's 90. Figures, guidelines have changed. And for females, 80 centimeters. Then as it progresses, it starts messing around with your liver and you get a fatty liver. And when you get a fatty liver, the HDL is produced there mainly. The HDL or the good cholesterol levels come down and the triglyceride levels go high. So, and then of course you can have hypertension because there's sodium retention. So you could have a high uric acid value because uric acid is also, so they'll end up with gout. So this is how we figure it out. But mainly the testing we do is fasting, blood sugar, PP blood sugar. Not only does it tell you about diabetes, the IGT levels reflect that a person, which IGT means impaired glucose tolerance, which reflects that a person has got hyperinsulinemia or high insulin. And this high insulin is deadly for causing weight gain and is the commonest reason. Then you do 3 months HbA1c. HbA1c is glycosylated hemoglobin, also gives us a very good idea, the values. And then you have, you can do insulin levels with sugar levels, and they work out through a formula, and that's called HOMA, which Dr. Misra will soon be talking about. That's another important way to tell. So, but clinical is very important because insulin really plays a fool. Levels are not very reliable. So by and large, people are looking more towards OGTT. In pregnancy, you do with 100 grams, here you do it with 75 grams, but it's very unreliable. So you have to have a keen clinical sense, but yet we have to work hand in hand with the laboratory, with the pathologist is very, very important. Okay.
Wonderful. So insulin resistance, perhaps the main cause of obesity, and of course, visceral fat or the abdominal fat, lot to do with it. Having waist circumference 80 centimeters or less for ladies and 90 centimeters or less for men is therefore an important goal, right? Dr. Bhatia, you mentioned also that insulin resistance, the commonest cause of obesity. People feel all the time very, very lethargic and low to no energy in this, So are there any other factors which cause such fatigue, and how would we test them?
So, yeah, I'm very, very glad that somebody's brought this up because we in VLCC and other my clinics also, what we have been noticing is that, very often the patient comes in and says that, we have a problem. We are doing everything from nutrition point of view, but we just can't exercise. And really, you look at the person's face, there's tiredness written all over. And you really, you're like flogging a tired horse. So as a physician, the first thing which you should do is find out why is the person tired. And the commonest cause of tiredness in our country is anemia, especially in females. And iron deficiency anemia, which is very commonly missed. So it's very important to do a good lab serum, iron profile. And out of that, more than iron, I think ferritin should be done, because ferritin really tells you the bone marrow stores. So the complete, with your just hemogram is not enough. You have to look at the iron profile. Also, another very important cause of hemoglobin dropping is low B12. And B12 by itself is very important because the entire nervous system bathes in B12, entire nervous system. So if your B12 is low, you're going to feel tired. If you have diabetes, in addition, you're going to get pain in the legs. You can get paresthesias, which means pins and needles, hands crawling. And if you're the older age group, it's one of the important reversible causes of dementia. Very, very important cause of which you can reverse. So low B12 will create havoc in the body, and of course weakness. From obesity point of view, what we see in VLCC, if the B12 is low, they're not going to exercise. They're going to be tired all the time. Then we always screen for TSH, for thyroid. So TSH screening, if they can afford it, very often they say, Doc Saab, pura kara lo. So we do a T3, T4, even the antibodies. But otherwise, I would go by the TSH, which is very, very important. D3, vitamin hydroxy D3. D3, not only is it important for bones, if it's low, your immunity is going to be low. They found a lot of patients landing up in hospital with COVID had low D3, and that is probably a reflection of your immune system. So D3, in fact, nowadays the latest guidelines are, CDC guidelines, give D3, even if it's normal, every day 60,000 units for 3 days in a COVID case, freshly diagnosed. Very important. So D3 is another very important thing. And there's this inflammatory theory of obesity, which is that if your D3 levels are low, it's going to cause more inflammation in the body, and it's going to cause insulin resistance. So it's going to block your receptors. So D3 is very important, especially if you've got central obesity. It might, to some extent, it will reverse it. So D3 is another thing for tiredness, TSH, B12, iron profile. And I would definitely do in males who say that we are tired all the time. I would definitely do a sleep study to rule out obstructive sleep apnea. Because if they're apneic, there's going to be a problem. They're going to be tired all the time. Fatty liver is another thing, which, one of the symptoms before the bloating comes, before you start getting nausea, loss of appetite, fatigue is a very important symptom for this. And therefore, the entire thing, I would say metabolic syndrome. So therefore, we also check the HOMA, we check the insulin, we check the sugar, because pre-diabetes is a very important cause. Because again, sugar is supposed to go from the blood to the cell. How can it go if the receptors are blocked? It will not go. So therefore, if you're not getting sugar, simple glucose, where's the energy going to be? That provides energy. The entire thing starts from there. So we have to, do these testings, and it goes a long way in helping the patient or the client. Long way before you do anything else.
Right.
So from my conversation, you must be figuring out that it's a combination of, good clinical acumen with a good pathologist working with you. You cannot have a standalone. Like in VLCC, it's simple. A nutritionist cannot give you weight loss. It has to be the physiotherapist, the fitness person, the psychologist, the doctor. That's why we have 6 verticals there.
Right.
It doesn't happen alone. I can't give weight loss alone. It all has to be done together. And then you get fantastic results. Of course, you have to have a person who's complying with you. That's important.
Right. So if you're not feeling up to the mark, feeling very lethargic and weak, just go for your tests, check for anemia, check for your ferritin levels and vitamin B12, vitamin D3, thyroid, TSH, and of course you have to really rule out sleep apnea and insulin resistance. So that's what we are talking about. Right. Of course, Dr. Bhatia, we have seen that even without showing symptoms, people sometimes, test positive for certain diseases. And then there is a question, should one start treatment based on the report or wait for the symptoms to show up? So what is your view on this and what would you suggest?
So the classical teaching is, which all our professors taught us years ago. They said, treat the patient and not the report, right? Or I would rephrase it, you know, treat them in tandem together. Do not isolate. It's very important that that's why to reiterate, I was saying that before also. It has to be done together. So there are examples. Like, for example, you'll get Rh factor, rheumatoid factor positive, and that can be a false positive. Person has got no arthritic pain. I'm not talking about knees. I'm talking about rheumatoid arthritis, like, stiffness in the joints and early morning classical metacarpophalangeal joint, thumb, being stiff and then pain. And then that is, if a person has got no symptoms, I would not treat. I would follow up. I would do that. And similarly, you may have a prostate PSA coming positive. And sometimes I'm surprised people are treating that PSA. And the reason is positive is because just 2 days before that, somebody's done a rectal examination or somebody has catheterized. So you're going to get a false positive. So wait for a week, 10 days, and then do it. Or if it comes, to be conservative and be careful, I would again do the testing after some time. Similarly, you'll find a Vidal, which is positive for typhoid. I'm very excited. And you start the poor man on antibiotics. It may be dengue. Dengue and typhoid, very often Vidal comes positive in dengue. So why would I start giving powerful, and typhoid, it's resistant nowadays. You've got to give very, very powerful medicines. Right. And then you're making them resistant. And dengue is a virus. It's not going to help you at all. Or you could get ulta, you can get false negative. Like if you do Vidals too early in typhoid, you'll get a negative. So then you rely on blood culture. So again, your clinical thing comes in. What I would tell people is, do not, a lot of people, I'm shocked, people come to me with a whole lot of tests. And I said, okay, that's, who have you been going to? Who's your doctor? They said, nahi, Google mein pad ke humne ye test kar liye. So Dr. Google is the most dangerous. You see, it's not so easy. You have to put everything in perspective. Time-wise, timelines are very important. Medical history is important. Investigations, of course, very important. Your examination, clinical examination, very important. So it all has to be done together. Otherwise, who's the sufferer? The patient is the sufferer. That's it. So that's important. Right. I think that answers the question. Basically, the bottom line is, I think you could say, treat the patient and not just the report, or treat both together. That's more, let's rephrase. That's really important.
Like Dr. Bhatia has just said, not all positive tests have to be treated if there are no symptoms, but always, leave the judgment to the doctor and don't ever self-medicate, right? So thank you, Dr. Bhatia. That was really wonderful. And thank you so much for providing good insights for our viewers. And let's wait for more questions later after we have done with other speakers. Sure. And thank you so much once again.
Thank you, Dr. Anju.
Thank you. So I'm now very pleased to introduce our special guest on the panel, Dr. Angeli Misra. She is the director, Lifeline Laboratory, one of the premier advanced pathology laboratories of Delhi NCR region. And she carries deep technical expertise and experience spanning over 34 years in clinical pathology and 31 years as chief administrator and torchbearer in raising this Lifeline Laboratory to meet the highest international standards. So she has exceptional proficiency in histopathology, cytology, microbiology, biochemistry, immunology, oncology, hematology, and clinical pathology. So we have it all here. And of course, she completed her MD in pathology with a gold medal from All India Institute of Medical Sciences, New Delhi, and has also received the Mohanlal Big Gold Medal for her remarkable contribution in the field of clinical research. And also, she is a philanthropist and supports and works for humanitarian causes such as healthcare for Authority of India, GAIL, HUDCO, IGNO, and LIC, to name a few. Wow. Welcome to the webinar, Dr. Angeli. It's such a pleasure to have you with us today, and really thank you for joining us.
Thank you, Dr. Anju, for having me here today. And the pleasure is all mine. It is a great honor to be on this platform today. And I must commend you and VLCC for all the good work that you are doing in the field of preventive medicine. And I think a lot of attitude has been changed by your hard work and all that you're doing.
Thank you so much. Thank you. Thank you so much. And our viewers are all excited and have a whole list of questions for you. So let me start with the first one. And of course, like we said earlier, we have a lot of our clients suffer from obesity, from diabetes, from hypertension and other metabolic disorders. So which tests would you recommend and how often should they be repeated so that they can keep their condition under control?
So, Dr. Anju, there are two types of tests that we are going to recommend. And one is to diagnose the condition. And second is to diagnose the outcome of the condition, right? Now, if we are talking about metabolic disorders, there are 5 criteria that go on. 2 of these criteria, that is the waist circumference and the hypertension, is measured in the clinician's office, right? And there are 3 criteria, which is high triglyceride, high blood sugar level, as well as low HDL level. These are the values that are measured in the laboratory. So what we recommend for diagnosing, which just plain diagnosing of a metabolic disease, is a simple lipid profile, which would include the cholesterol, the triglycerides, and the good and the bad cholesterol, sugar level, and also the level of, like I've already said, the HDL level. Now, what we aid for the diagnosis is some other tests, and this is like an HbA1c that we do. That is glycosylated hemoglobin, which Dr. Dhiraj Bhatia has already spoken about. It gives you a mean glucose level for 3 months, right? So that is a good, very good test to do to see what your mean glucose level has been for the last 3 months. The other things that what Dr. Bhatia spoke about is the insulin resistance and how do we know that the body is resistant to insulin. What happens is that if the body is resistant to insulin, we need more and more insulin, right? So the body keeps secreting more insulin, and therefore we have to measure the levels of insulin. Now, if the levels of insulin, like Dr. Bhatia said, it's not a very reliable test on its own. So we combine it and we make a ratio of it, which is known as the HOMA-IR ratio. And what we do is we take a fasting blood sugar level, a fasting insulin level is done, estimated in the laboratory, and a ratio is taken out. And this is the ratio which tells us whether a person is insulin resistant or not. Now, any value less than 2.8 is considered normal. And more than that means that you are impaired. You have insulin resistance. These are the tests that are done to diagnose the condition. Now, what happens if you have metabolic syndrome? You are prone to heart disease, you are prone to heart attacks, you are prone to strokes, and now we also know that you are prone to chronic kidney disease, renal failure, and hepatic fatty liver. Dr. Dhiraj Bhatia has already spoken about. So then there is a second series of tests that we are doing to establish if these organs are being affected. Right. So what we do for cardiac is that we do a couple of tests that aid the diagnosis and the outcome of what is going to happen with the insulin resistance. And there are 2 very important tests I would like to talk about. One is HSCRP, which is highly sensitive C-reactive protein, and the other one is homocysteine. CRP is an inflammatory marker. And Dr. Bhatia, again, he spoke about inflammatory theories of, obesity and all that. So it's an inflammatory marker, and we get to know if the value is high. The presumption or the conclusion, I would like to use the word conclusion, is that there is some inflammation going on. And this inflammation is also including the blood vessels and the possibility of an atheroma. This inflammation is causing an atheroma or an atherosclerotic plaque, and that there is higher likelihood of, having a stroke or a cardiac event. The other very important test to do is, so we look at HSCRP very carefully. Other very important test to do is homocysteine. Now, homocysteine is an amino acid, which is a part of a protein. And if the homocysteine level is high, the outcome of any cardiac event is going to be bad, right? The good point is that homocysteine can be metabolized and broken down by giving high levels of folic acid and B12, right? What does homocysteine do? It decreases the good cholesterol level. So that is, so it is very important also to monitor the levels of homocysteine. Third thing I will add here is fibrinogen. That's another thing that we add in the patients of metabolic disorders, diseases, is fibrinogen. And if the values of fibrinogen are high, that would indicate that the outcome of a cardiac event will not be so good, right? So it's a prognostic parameter, and we say that it's not going to be so good with that. Now, in addition to all this, there are other hormones in the body. And out of that, Dr. Dhiraj Bhatia spoke about the thyroid hormone, the T3, T4, TSH. They play a very important role, along with insulin. So it's very important to do a thyroid profile in all patients who are suspected of, a metabolic disorder. Now, we also want to look at what is the outcome, what is happening to the liver, and what is happening to the kidney. So a kidney function test is very important, and a liver function test is very important. Now, in the liver, gamma GT is very important, and kidney function test, the uric acid test is very important, because the uric acid is not only, it's like a cause and effect kind of thing. Uric acid is not only the cause of, the metabolic syndrome, but it also is causative. It worsens the situation. So these things also have to be monitored in a patient of, who has got metabolic disorder. Now, the question is, how often should you do these tests? Now, if the results are normal, we can even repeat the test annually. But if the results are abnormal, then it is entirely the clinician who will guide you to ask how often the tests need to be repeated, because the clinician will put on a protocol of treatment, intervention, it can be exercise, diet, whatever, like you do at VLCC. So after the intervention, it is the clinician who will decide how often these tests should be done.
Wonderful, wonderful. So if anyone is obese and is suffering from metabolic problems, so these are the tests which are mentioned by Dr. Anjali. Of course, you need to rule out insulin resistance, HbA1c, HOMA, IR, and lipid profile, of course, and the TSH for thyroid, and KFT and LFT definitely, and of course the inflammatory markers, HSCRP and homocysteine. So that was a very good compilation of all the things that can be done and checked. So Dr. Anjali, there are a lot of questions, and the one is that what are the tests you would recommend, especially for men?
Yeah. So Anju, there are certain tests, different men at different ages will require different, different things. But what is most important is that one thing is universal, and in all men, they have to look after their cardiac health, and they have to make sure that they do not land up in a state of diabetes, or if they are pre-diabetic, we should know it. So the cardiac health, which means the lipid profile, should be very regularly done. And there is a little bit of a controversy. When should we start doing it? I get a lot of these questions. Oh, I'm only 20. Do I need to do the lipid profile? So the recommendation is actually, Anju, that you should start doing, first lipid profile should be done between the age of 9 to 11.
Wow.
That's very young, right? And in case there is an abnormality, then the clinician will do the right intervention right then to prevent childhood obesity. We have a lot of childhood obesity in our country. And subsequently, if the values are fine, it can be repeated every 5 years. Or, if they are abnormal, like I said, the clinician will guide as to how often the testing should be repeated. That is one thing. Then the sugar and the OGTT and the other tests that we talked about, insulin resistance, should be done because diabetes is very high in our country and we need to keep a check on that. And we are having diabetics at a much younger age now. Now that is, and post the age of 40, that is, till 40, all this has to be really in focus. And post the age of 40, men have higher chances of having cancers. And the two most common cancers are the colonic cancer as well as the prostate cancer. So there are very simple tests that can be done, just a screening for colonic and prostate cancers. For the colonic cancer, we do what is known as the occult blood, and now we have what is known as the highly sensitive occult blood. If this test is positive, then of course, the next steps need to be taken. The person may have to go visit the clinician and, may need a colonoscopy. That will all be decided by the clinician. And so this is a very simple, all you need to do is it's just a simple routine stool test, right? The occult blood test. For prostate, we need to do a test which is called prostate specific antigen. And it's a blood test. And prostate PSA, as it is called, is a marker for prostate cancer. And if these values are high, again, then the next steps need to be taken, which could be ultrasound, an examination, visit to the doctor, or biopsy. But these are the simple tests that all men should try to do in their lifetime.
Wonderful, wonderful. And one of our attendee, her name is Preeti Singh, and she says, hi everyone, what type of tests need to be done at the age of 40, especially for females? So we'd like to know more about females, testing for females especially, right?
Okay. So Dr. Anju, I would say that the same testing that is done for men in terms of looking after the cardiac health is very important for women at 40. And in fact, again, they should start much earlier. The tests for looking out for insulin resistance should be done for females of all age. And also what is very important, like Dr. Bhatia said, is nutritional problems. Females have a great deal more nutritional problem, in our country and worldwide as compared to men. So nutritional problems are important. So they have to be looked out for. So ferritin levels, CBC, and the iron studies, as Dr. Bhatia has already advised, they really need to be done for the females. What is also very important for females of all ages, and I won't say only after 40, is to do a routine screening for cervical cancer. Now, cervical cancer is preventable, right? And it's one of the leading causes of death in our country in women. So what you really need to do, starting early at 21 and going on to the age of 40 and beyond, is to do a test that is known as the pap smear. The pap smear has to be repeated every 3 years if it is normal. Now, we also know that cervical cancers are caused by a virus called human papilloma virus, right? So now there is tests that can be done with the same cervical pap smear. What we can do is a test which is called as the HPV testing. And if we combine the HPV testing with the pap, it's an extremely good screening test, and it's called the co-testing. And this has to be done every 5 years. And for women who are beyond 40, they should continue at least till the age of 65. This is about pathology. We would also recommend for women above 40 to self-examine their breasts and to do an ultrasound of the breast, to rule out the breast cancer.
Wonderful. So Preeti Singh has got her answer, and so also all of us, all ladies here. So it's always better to be proactive and go for the tests which have been mentioned by Dr. Angeli. Dr. Angeli, there is another question, and that's for the COVID that we have had, the crisis, and which made everyone rush to get themselves tested. And there were a lot of these false negatives and false positives also, especially for the rapid antigen test and even otherwise. And are there really more reliable tests available for this? We'd like to know more.
Yeah. So Dr. Anju, I'm just going to quickly divide the tests, how they are done. So the two main common test methods of testing is the rapid antigen testing and the PCR testing. Now the rapid antigen means it is an antigen. So you're testing the protein of the virus. This test is specific, but it is not so sensitive, which means that if the virus load, the number of virus is not very high, this test is not going to pick up, and so you will be shown negative on the test while you will be positive. This test is good to be done in screening, like, you're doing mass screening or you just want a preliminary test. And if you're positive, then that's fine. Then you treat yourself as positive. But if you're not positive on this test, then you need to really redo the test by the PCR method. Now, the PCR method is looking at the genetic material of the virus. You look at the genetic material of the virus and you take a part of it and you magnify it and you look for it. Now, what is the problem with this test? The problem with this test is that you can pick up false positives, which means that you do not have the disease and yet you can pick it up. Now, why do you pick it up? Because, you can have a dead virus. And you must have heard this and you must have read this in the news that there are, after 3 weeks, 6 months, the test is still coming positive.
Absolutely.
It's not because the person is infective. It is because there's a bit of the dead virus which is still left, or the fragment, is there, and that we are picking up because the test is so sensitive. Now, there are some other tests which are really 99.9% sensitive and specific, and they are done faster. So I would like to mention two of these. These are CB-NAT tests, which is nucleic acid amplification tests. And one is the gene expert test. The test result comes in about 35 to 45 minutes. And it's almost a foolproof test because there is no chance of cross-contamination. And there are very, very extremely low rates of false positive and false negative. And the other test is the INAT test, which is also, which comes in about 20 minutes. It's a kind of a rapid test in that sense, but it's very sensitive and very specific. It is again using the nucleic acid or the genetic material of the virus for testing. And it has very few false positives and false negatives.
Wonderful. So we have always been hearing about the antigen test and the RT-PCR, and this is something new, the CB-NAT and INAT and gene expert test. So if somebody really wants to know for sure, we can go for this. Right. Also, Dr. Anjali, so many people have been vaccinated now against COVID and have been also recovering from COVID. It's been seen, and it's also it's been shown that our immunity, it begins to come down or wane after some time. So is there, can we test to assess our immunity against COVID, at what level we are? What should we do?
Yeah. So there are two types of immunity against COVID. One is the cell-mediated immunity, which is against, that's the kind of immunity against all viruses. And we are not measuring in, it is possible to measure in the laboratory, but it is at the most done in research laboratories. And we are not testing it, commercially right now. But the other method, which is very simple, is testing the antibody.
Right.
And I would like to clarify here to everybody who's listening in that this is the neutralizing antibody that we must test for. We must not test for any other antibody, but then if we want to know our immunity, we should test for neutralizing antibody. And what does the neutralizing antibody mean? It means the antibody which will stick to the virus, neutralize it, and will not allow it to infect our cells. Now, post-viral infections and post-vaccinations, this is a very good way of estimating your immunity. The higher the levels of antibody, the more likely you are to be protected from the virus and the infection. And if you at all have an infection, it is going to be very mild. Now, how often should you repeat this? Now, it's also known that in about 6 months, this antibody level starts weaning off, right? So post 6 months after you've tested, you had an infection or a vaccine, Post 6 months, you should definitely look out for this antibody level, because it is going to wean. And at some stage, if you feel that, you will have to be extra cautious or careful or going for a booster dose if the antibody level is weaning too much.
Wonderful.
Post 6 months is the time that you have to look out for it.
Absolutely. So the one of our viewee, his name is Sandeep Kumar, and he said, is this what is called as after COVID effect?
The antibody testing?
Yeah.
So after COVID, the antibodies, like I said, the titers start going up. They peak in about 12 weeks time, and then post COVID they will plateau a little bit, and then they will come down. Also, I must tell you one thing: if you've been vaccinated, or if you had a prior COVID infection, and you have then got a booster again, or you've got a reinfection, all that, the way or the rate at which your antibody will rise will be phenomenal. It'll be, it'll go up very fast. And when the antibody goes up very fast, there may be some, like a flu-like syndrome with little fever, so that is also a possibility, but that only is because the antibody levels are rising very fast.
Oh, that's really interesting. Yes. Okay. Going forward, Dr. Anjali, there's so many questions, so let's try to accommodate as many as possible. So our increasing sedentary lifestyle and poor diet has resulted in poor bone health. So for most of us living in cities. So how could we measure our bone health?
Okay.
Yeah.
So Dr. Anju, there are very simple techniques of measuring bone health. One we all know is an imaging method, doing the DEXA, we've all known, but there's another very, very important method which even tells you about bone health before, it really becomes less dense. So what we do in the laboratory is very simple. We measure a few parameters, which include calcium, phosphorus, alkaline phosphatase, and there are two other parameters, which is known as beta cross lab and NTX. Now, what does this give us an indication of? These tests give us an indication of how much bone is being lost and how much is being formed, right? So you know that if your alkaline phosphatase is high, for example, that the bone breakdown is more, right? So what we do in the laboratory is these 5 tests, and we make a measurement of whether more bone is being formed or more bone is being lost. We say that the bone is healthy if more bone is being formed or it is equal to the amount of bone loss. So that's how we measure bone health. And I would say that in this day and age, it is extremely important to measure your bone health, because a lot of, these hairline fractures, pathological fractures, a lot of these we see in our practice, and I think one should really know about the bone health. Another thing that I would like to mention here, and I think I would like to mention also in terms to your earlier question about metabolic syndrome, is vitamin D. We have very low levels of vitamin D. We have almost, most of our population is deficient. So I think it's very important to assess your vitamin B. We know that it has more roles than just bone formation. We know that it has a role in immunity. We know that it has a role in metabolism. So that's another very important investigation that you should,
Wonderful.
Yeah.
If I may just add another question from Preeti Rati, and she says that what is the meaning of high BUN test?
Okay.
Yeah.
So high BUN is an indication of, it's a kidney function test, right? It's blood urea nitrogen, and there is the breakdown of protein happens, and the breakdown of protein is actually toxic to the body, right? So that is excreted by the kidney. If the kidney is working normally, that will be excreted out through our urine, and we will maintain a level which is optimal for the body. Now, if our kidney is not working properly, then this will not be able to be filtered. So the BUN levels will keep increasing, right? So that is what it means, and that is what it indicates.
Thank you so much. And of course, in the end, we'd really like to know that we have tests which confirms a disease and diagnosis, and we have tests which can also help us to prevent them. Would like to know more about it from you.
Okay, that's a very, 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 very pertinent question, Dr. Anju, and I would say that, you know, in pathology, we divide the tests into three. One is a diagnostic test, one is a preventive test, and one is a predictive test, right? Now, the diagnostic test, what does it mean? It means that it diagnoses a condition. For example, you take a biopsy, it says that this is cancer or not cancer. If it's cancer, you treat it, it's diagnosed. You take a blood sugar level and it's high, you say this man is diabetic and this needs to be now treated for diabetes, right? But there are a series of tests which are preventive, which are going to tell you that this condition is likely to come. For example, we do a lipid profile, right? So if the cholesterol level is high, we know that there is a possibility of cardiac events later on. Uric acid is high, we know that it can affect your hypertension, it can affect your metabolism. Thyroid is high. So there is a series of tests which we'll do to understand that if these parameters persist as they are, there is likelihood of some disease that will come up. So we can intervene right now and prevent that disease from coming through. And that is why we call it preventive. And I would say that there are very simple series of preventive tests which everybody should do, which includes doing a complete blood count, you know, like Dr. Bhatia said for anemia, doing a liver function to look at your liver, doing a kidney function to look at your kidneys, to do a lipid profile, to do a sugar level, an HbA1c level, a thyroid level, which is extremely, thyroid has an effect on everything, a vitamin D level, a urine, a stool, and when you do the stool, you do also the occult blood with it. This is a very simple, preventive health, and it gives you immense information of what might happen in the future.
Absolutely, absolutely wonderful, wonderful. So we have a viewer who's saying that if we are going for tests in the pathological labs, then what accreditations we should look for?
Great. So you should definitely see a few things. One, the laboratory should be run by doctors, right? There are a lot of laboratories that are being run by technicians. The doctor should be qualified, should be a pathologist, you know. Secondly, and thirdly, it should be NABL accredited, which means that there has to be some quality check on it. So these are the three basic parameters that anyone should look for.
So that was the question from Shivangi Singh, and she's got an answer. So thank you so much, Dr. Angeli. This is really so wonderful, and thank you so much for really deepening our understanding of the role and benefit of path tests. And you explained it in such a simple and nice manner. I'm sure everybody's enjoyed it and learned so much from it, including us, and it's going to really help everybody here. So thank you once again, and we'll still have you again later if there are some more questions, and that's so nice. Thank you.
Thank you, Dr. Anju.
Thank you so much. Dr. Bhatia, if I may just bring you in, there's a question by a viewer, and she says that I would still like to know what is insulin resistance, because we are talking all the while about insulin resistance, and she wants to know more about it.
Yeah, so let's put it very simply. When you take a meal in the morning, you're taking glucose, right? Now that glucose goes into the blood, and from the blood, the body wants to remove it. It wants to send it where it has to work. It wants to send it into the tissues where it's going to provide energy. Now, what happens in some cases that, it's not so easy. It cannot just go from the blood into the tissues. So there is these receptors, nature has made it like that. There are these receptors. They have to be open, or let's say the gates have to be open. Then the glucose sweeps into the tissues and gives energy. Now, these receptors get blocked, and they get blocked particularly if you've got central obesity, because then the adipocytes, which are the fat storing cells, what they do is they release free fatty acid, which combine with some proteins, very long names for those proteins, the three of them which have actually just been discovered a few months ago, plus with some cytokinins, which are inflammatory products, which are dependent on D3. So these three, I call them Lord Hanuman. They go and sit on the gates and they block the gates, which are the receptors. So sugar, your glucose cannot go inside and provide energy. So now who controls the gates is insulin. And where does insulin come from? Pancreas. So the tissues are sending a message because sugar is not going in, they're getting tired. My body's getting fatigued. So they send a message to the pancreas, mother, help me, help me. And she releases more and more of insulin. That stage is called hyperinsulinemia. So first stage is insulin resistance, which simply means that the receptors are blocked in the tissues and the cells because of free fatty acids and your proteins. It's a complex which blocks it. And these are actually coming from your central obesity, from your adipocytes from there. So that leads to sugar not going inside and providing energy. Result is what? Result is that there's a cry from all the body tissues. They're telling the mother pancreas, help. So she'll release more insulin. Now the question is, why are you gaining weight? Because you're gaining weight because insulin is lipogenic hormone. Now there's a process which goes on in the body all the time. Glucose converts into glycogen, higher form of storage, and glycogen converts into fat. So what insulin does is converting more and more glycogen into fat. That's why it's called lipogenic. And it does not allow fat to burn. That's another problem. It decreases the lipolysis. So it decreases the fat burning, which is bad. And second thing which it does is it promotes the free fatty acids to go more into my visceral area, my tummy area. That's why the moment person walks into my clinic with a huge paunch, I know he's got insulin resistance and hyperinsulinemia. That's why insulin is called a lipogenic hormone. I hope that answers. I try to make it as simple as possible without my charts and.
I think that was
that's the reason.
And
Anju, there's another lady asking something about thyroid. I'll quickly address that. What she's saying is that her husband has got no symptoms of thyroid, and yet TSH is high. So what's the reason? So the reason is that the person has probably got latent hypothyroidism. So latent is when it's from 4.5 to 10. Now 4.5 to 10, especially if there are no symptoms, don't treat. That will reverse on its own, just with a little bit of de-stressing, because stress is notorious for causing high TSH. Okay, some medicines also cause high TSH, like lithium, which you give for MDP, kind of depression and psychiatric illness. And there are some anti-inflammatories which cause it. Having ruled all that out, I will not worry. If there are no symptoms, after 3 months, I would again look at the TSH. Sometimes it's slow. The symptoms like, dryness, cold intolerance, loss of hair, fatigue, all these symptoms, constipation, they come a little later. Dry eyes, hoarseness, they come later, slowly. So, but very often it reverses. Just with lifestyle management, little weight loss, good cardio, and de-stressing. Do some good yoga, do some good pranayam, and tell the lady her husband will be fine.
Wonderful. That was the question from Pallavi Jain, and I'm sure she's got all the answers. So thank you so much, Dr. Bhatia, and let's move forward. So we have our third panelist, the next panelist, Dr. Deepti Verma, with us now, who with over 25 years in the field of nutrition and dietetics, currently heads nutrition at VLCC Skill Development, and she has been a lecturer, medical nutrition consultant, writer and editor, and she has been felicitated with several awards for her contribution to nutrition, including a Lifetime Achievement Award. And so welcome to webinar, Dr. Deepti. Pleasure having you again. And yeah, let's get going. There are a lot of questions there.
Okay. Thank you so much, Dr. Ghei.
Yeah.
Pleasure, absolutely. This is our 12th webinar, so feel so proud about it.
Absolutely. So the question, I'm just, combining a lot of questions into one, which is that often tests, especially the blood tests, they reveal deficiencies in our body like minerals and vitamins. And so can such bad test results guide us for better nutritional choices? And also, how does nutrition help us managing comorbidities?
Yeah, so it's actually when patients come to us for diet consultancy. So of course, like from a generic kind of a diet that we give, we actually customize the diet as per the pathological reports. Because somebody comes, like for an example, with feeling very very weak and looking pale and yellow skin. So it is like, we cannot just make a diet basis the clinical symptoms. We would need to read the report and know that whether it is a high bilirubin level that's giving them a paleness, or if it is a very, very iron deficiency anemia that's making them look pale. And accordingly, we can customize the diets, because there are so many symptoms, which are common to different comorbidities. So a person might be, as Dr. Bhatia and Dr. Anjali said, might be, like not very obese, and someone who looks thinner, fitter, actually, might be suffering from a very, very low level of good cholesterol, the HDL level, which is low, and a high level of LDL, and a very high total cholesterol. So the diet is customized accordingly. So of course, the results are bang on, when we actually customize the diet basis, the pathological reports. Otherwise, one just gets lost and it becomes like a more generic diet. So this is actually what the thing is like. So hence, it's so important to actually have the pathological reports while making the nutrition prescriptions to patients.
Absolutely,
So yeah, that's how
absolutely. I'm sure, and that is how we customize and make it so special for all the problems that people come up with, whether it is deficiencies or any diseases. Thank you so much, Dr. Deepti. That's for reminding us that food is also an important route to good health, and guided by tests, you can help us make wiser choices of what we eat. Actually, our body comes perfect when we are born, and it's the only one we'll ever have. But unfortunately, it comes without a guarantee. So we alone are responsible, and how we use it or abuse it will determine how long it remains healthy and trouble-free. And so, don't have to wait to fall sick. Prevention is the name of the game, remember, right? So, Dr. Anjali, before we sign off, there is another question which is so very important, and we won't want to leave without the answer. So, can immunity be measured? Because we are all the time talking about immunity, and so can it be measured, and how do we do it? Yeah.
So, Dr. Anju, this is a very, very complex subject, and immunity as such is very complex, and to measure it is really very difficult. But what we can measure is the certain elements that can affect our immunity. For example, we know that there are certain vitamins, certain minerals, that will affect our immunity, that will cause the decrease in the immunity. So we can measure these elements. For example, we know already that we measure vitamin D, so we can measure all the vitamins. We can measure vitamin D, we can measure E, we can measure C, we can measure B12, folic acid, everything. So this should be really measured. We know that immunity is affected if our iron levels are low. We should measure those. Then there are certain trace elements that, elements that are needed in our body in very, very tiny quantities, like for example, zinc, selenium. These should be measured, right? To see whether these are in adequate amounts. Right. Then, so these are the elements. So then you don't directly measure immunity, but there are indirect ways of doing it. If any of these are deficient, then we know that our immunity is not going to be optimal. And all these can be then corrected by the diet. So it's very important to assess the level of these elements.
So thank you all so much for attending our webinar and guiding our conversations with your wonderful questions. Thank you also to our panelists, Dr. Angeli Misra, especially for joining us today, and Dr. Bhatia, Dr. Deepti for all our learnings today. And we hope to, really hope you have a better understanding of what PATS tests are and how they help us. And if you wish to know more, there is always a VLCC center near you where our team of experts are just waiting to meet you. So wish you all robust health and a life full of happiness and fulfillment. Good evening and goodbye. Thank you once again.
Thank you.
Thank you. Thank you so much. Bye-bye.
Bye.